Are you a breastfeeding mom wondering if you really need birth control postpartum? Let's talk. Hey moms, I'm Dr. Shaunna Mason. I'm a board certified OBGYN practicing here in Houston, Texas, helping moms learn more about their bodies as they get ready to have a baby and as they recover postpartum. So, at many 6-week visits, your doctor may ask you about birth control and what you're thinking about. And while needing birth control or even having sex at this point is maybe the furthest thing from your mind, it is an important thing to think about because even if you're breastfeeding, you may not have great birth control. So let's go over some of the changes that our bodies go through when we're breastfeeding and why some moms can't rely on breastfeeding as their sole means of pregnancy prevention after they have a baby. When we are breastfeeding, our bodies are really focusing mainly on milk production. They are not focusing on ovulation or regenerating our hormone cycle that we've been used to all these years when we aren't pregnant. Our estrogen and progesterone levels are very low when we are breastfeeding, and our ovaries are kind of in a quiet state. And this leads to some changes that many moms are not prepared for, things like not having a period and vaginal dryness, joint aches and pains, and all of that is really, really normal. The thing about breastfeeding is, especially when you're exclusively breastfeeding, the hormones that it takes in our brain to supply milk. So, the thing about exclusively breastfeeding moms, meaning that you are feeding or pumping every time they are hungry, you are basically their sole source of nutrition, the hormones that it takes from our brain, the production of prolactin being that high to stimulate that level of milk production often shuts down our ovulation cycles. This puts us into an amenorrhea state or a no period time in our lives. This means that our ovaries are quiet, our hormones are low, and we are not ovulating or releasing an egg in the same rhythmic pattern that we've been used to. So, for you moms who aren't really interested in birth control or hormonal forms of birth control, I should say, it seems easy to rely on breastfeeding as a means of pregnancy prevention because you aren't having a period, so probably can't get pregnant. The tricky part about that is that when your hormones shift back to a normal ovulation cycle or a normal hormone state, your ovulation will happen before your first period. And this is really important to know, so I'm going to say it again. Your ovulation will happen, or the release of an egg will happen before you have your first period. So your fertility will return before you realize it's back. And this is what makes exclusive breastfeeding difficult as a sole form of birth control. So, what are your options if you can't rely on breastfeeding? So, let's talk through that. So, when your period comes back and you've had a couple of normal cycles, then you could go back to what we call natural family planning or cycle tracking or just using barrier methods or abstinence during your more fertile time. But until you've had a couple of cycles, it's hard to know that things are back on a predictable pattern. So, in the beginning, I think there are a few options you can consider. And I think knowing what these options are, talking to your partner and deciding which one you think you're going to use before you go into your 6-week visit helps you have a more productive 6-week visit with your physician. So, one of the more common things that women use when they are breastfeeding, because it's a non-hormonal option, includes barrier methods, things like condoms. There's also great spermicides on the market. Some of them are prescription strength now and seem to work better than things you can buy over the counter. Now, this allows you to prevent pregnancy without having to take hormones that many women worry may affect their milk supply or may affect their mood or how they're feeling, and they just don't want those things in their body while they're recovering from having a baby. So barrier methods can be reliable when used start to finish every time. So that's the commitment that you and your partner have to make whenever you are choosing this as your birth control option. When you've had a couple of regular periods and you feel confident that your system is restarting, rebooting, and getting back on track, then you could go back to using barrier methods and spermicides with natural family planning, which is where you use those during your more fertile times of the month. Other options include IUDs, so those are long-acting pregnancy preventions. There are hormonal, very low-dose local effects, things like the Mirena IUD, the Liletta, the Kylena. even the Skyla. These are IUDs that you can place in the office at a doctor's visit that provide you low dose hormonal contraceptives, but aren't going to affect your milk supply, aren't going to affect your hormones throughout your whole body. The tricky part about those is they can really suppress having periods because they make the lining very, very thin. So even if your hormones are coming back on track, you may not be bleeding. So hard to say exactly when your cycle is rebooting if you have an IUD that may be also suppressing your period. Now, there is a non-hormonal IUD called Paragard. It uses copper to accomplish the same goal for pregnancy prevention, whereas all the IUDs create a place where sperm can't function. This is how they prevent pregnancy. So they aren't affecting our hormones, whether you choose a progesterone low-dose option or you choose the non-hormonal copper option. The mechanism of action is very similar as to how they prevent pregnancy. So the copper IUD can be placed after your delivery, after your recovery, and can stay in for up to 10 years. So it's a very great option for people who aren't thinking about having a baby again in the near future. Now, this can be placed in a doctor's visit, usually at around or after your 6-week postpartum visit, and it's placed with the procedure in the office, and it can be reversed or removed whenever you are ready. Ideally designed to provide long-acting reversible contraception. That means they can be placed and removed after years of being there. So from a cost-effective standpoint, it's better to use the IUDs if you're planning several years between children, but we can remove them at any time if your goals or choices change. So the Paragard IUD works to create a hostile environment for sperm where they just can't get through and get to an egg no matter when it's released, right? And the thing about Paragard is it doesn't suppress the endometrial lining. So as your hormones reset and things start to try to get back to normal and your body reboots that hormone cycle, you should start to see your periods coming in a pretty regular way if everything has reset itself the way we expect it to. Now, if you had irregular periods before, you may go back to having irregular periods after a baby, but the Paragard really shouldn't have a big impact on that. These are wonderful options for people who aren't interested in getting pregnant, but they think they may want another baby someday because your periods are usually light and short or non-existent, and so you just don't have to worry about that while you are recovering from having a baby. Another option that doesn't affect your milk supply includes progesterone-only birth control pills. These are often known as the mini pill. And what that means is it doesn't have two hormones in it. So most traditional combination birth control pills have both estrogen and progesterone. And there's a lot of good research out there that suggests that if we give you estrogen, especially in those early weeks of pregnancy and breastfeeding and recovery, that it can actually work against that prolactin production in our brains and suppress some mothers' milk supply. And we don't want to do anything to disrupt your milk supply when you are working so hard to feed your new baby. So we don't use combination pills, especially in the first 6 months for moms who are working very hard to build a well-established milk supply. And so we use a progesterone-only option. If you read online, these sometimes get a bad rap, but truthfully, the progesterone part of a birth control is the only part you need to suppress ovulation and prevent pregnancy. While combined pills have lots of advantages when you're not breastfeeding, the only part you really need is the progesterone, which is why we use the mini pill so easily in moms who are breastfeeding. It provides great, quiet background birth control. Most moms don't have a lot of side effects on the mini pill because it is just one dose and very low, but it will block that ovulation as your body starts to reset. So even if your FSH and LH are rising in your brain and it's trying to tell your ovaries it's time to start revving up that estrogen and progesterone again, it will allow that to happen, but not at a level that will allow for ovulation. So if you are committed to taking a pill every day, if it's easy to add that to your prenatal vitamin or other medications you're already taking, it is a good option for moms because it's easy to stop and start it when you're ready to have another baby. So you could use it for the first 6 months or 12 months or as long as you are ready without having many side effects and without it being so strong as a combined birth control. So I find that a lot of moms are sort of hesitant to use this pill if they've had side effects or frustrations on a combined pill. But I encourage you to give it a chance if this feels like the right option for you. You're not really interested in multi-year pregnancy prevention. You're ready to have a baby again, potentially in the near future. And barrier methods or spermicides just don't work for you, that provide irritation, or you just don't feel like they're reliable enough. then a progesterone-only birth control can be really that sweet spot that allows you to give it a try. If it makes you feel bad, it's easy to just finish a pack and not restart another one. Or it's easy to finish a pack and not restart another one when you're ready to have another baby and kind of see what your periods look like after that. Now, much like the progesterone IUDs, if you're taking this pill every day and it's such a low dose, it works very similarly to thin out the endometrial lining. So many women don't have much of a period on the mini pill, maybe some light spotting that feels kind of erratic and unpredictable. And remember, that's kind of a fake period. We aren't really having regular periods because we're blocking some of the hormones that allow for us to have a regular period, and that's how it prevents pregnancy. So, breakthrough bleeding or spotting is one of the bigger frustrations on all of the progesterone only options. But it's hard to know exactly when your period's back because you probably won't be having much of a regular period on a mini pill. Now, there are other options like the implant in your arm called Nexplanon. That's also progesterone only, works very similarly to the other options, as well as the depot shot that you get in your muscle. It's actually given in a bigger muscle, but every 3 months that you can use that's also progesterone only. These things tend to also block your cycles, block ovulation, and that's how they prevent pregnancy and are all reversible once they're removed. Depo's a little tricky because it's deposited in our bodies into the muscular system and then sort of slowly dissolves over time. And so while we recommend that you get a repeat dose every 3 months to prevent pregnancy, it's hard to know exactly how long the medication will take to get completely out of your system and allow your hormones and ovulation to reset. So some moms who use Depo postpartum and then they are ready to have another baby find that it's still another 6, 9, or 12 months before their periods are really back to normal and they find that they're ovulating. So for moms who really want to sort of be able to try when they're ready, they want their children close together or timed in a specific way, Depo isn't always a great option because it's hard to know how quickly your body will metabolize it and the complete effects will be out of your system. So these are some of the pregnancy prevention options that you can think about, even if you're a breastfeeding mom, that allow you to not get pregnant until you're really ready, not override some of your hormones that your body really needs to be so strong while you're breastfeeding, but also allow you to have some control over growing another human in your body before you're really ready, especially since you will not know when your ovulation has returned because you won't be having periods yet. So I hope that you found this video really helpful. I know this is a very confusing topic to so many patients. So drop some comments below if you have questions or things I didn't cover, or you're curious about other options, or if you're no longer breastfeeding and want to know what your options are. And I hope that, yeah. And share this video with your friends and other breastfeeding moms so that they are all well informed about what their birth control needs might be after they've had a baby.